Another interesting experience that I had, not me, but with my mom. My mom is 90 and she's fully functional. But a few years ago, I bought her an Apple Watch. And Apple Watch have a very nice feature that first it detects fall, but also you can basically set it up that if there is a fall, it can call a couple of relatives and also the police. So a few weeks ago, she fell and she lost her conscious. And immediately, her Apple Watch called my relatives and also the police. The EMT came immediately and basically saved their lives. So I think that's something that, in my opinion, for the elderly is an amazing tool because especially my mom and my father live alone. They are completely functional, but still, as I said before, they can fall and they can lose consciousness.
Welcome to Longevity by Design, a podcast designed to give individuals access to the leading scientific information in the field of longevity. The ability to add years to your life and life to your years needs no opinion. Join us as we ask science to take the wheel. In each episode, Dr. Gil Blander joins a co-host and an industry expert in the field of longevity, shining a light and getting the answers to the key question: how can we live a longer, healthier life?
Hello, I'm Ashley Reaver, and welcome to Longevity by Design, How to Live a Longer, Healthier Life. We're produced by Inside Tracker, your science-based guide to optimizing your body from the inside out. Today's episode is an Ask Me Anything between Gil and I. We will discuss what are the best wearables for your specific needs, as well as what is known about GLP-1, based on our recent interview with Dr. Jens Juul-Holst, the scientist who discovered this hormone. It is essential to remember that we are not providing any medical advice, but hopefully this episode encourages you to take care of your health and wellness. So, Gil, let's start on your recent interview with Dr. Jens Juul-Holst. What is GLP-1?
Yeah, so GLP-1 is an hormone that is produced by our gut. And it's produced by the cells that line in the gut. And there are a large number of cells that produce many hormones there. So it's not only the GLP-1. GLP-1 is just one of them, and it releases when you eat. So basically, when you consume food, the gut signals to the rest of the body that you absorb some protein and carbohydrate and lipid, and it signals to the brain and the other organ that now it's a time to digest the food and basically slow down. GLP-1, what is interesting about GLP-1, and actually it was discovered a few decades ago by this scientist that you mentioned, which it's a fascinating story, and everyone that have time and 1.5 hours to spare, please listen to that episode. So the GLP-1 inhibit the appetite via slowing down the movement of the gut. So basically, the gut and the stomach are moving much slower. And then it's provide enough time for your brain to realize, hey, I'm full, let's stop consuming food. It's also slow down the secretion of pancreatic juice and gastric acid and other ingredient. So everything is basically slowed down in the ingestion and the digestion of the food. It's also help the body to deposit the glucose by stimulating basically insulin secretion from the beta cells in the pancreas. And it makes sure that the glucose is absorbed in the tissue. So it's all of this mechanism as a natural hormone, which is very interesting. And was shocking for me that the scientists just discovered such an hormone like a few decades ago and not much earlier. So I think that maybe there are other amazing hormones that waiting for us to find and we don't know about them yet.
Lots of science yet to be uncovered. And the drugs that everyone is hearing about all the time are targeting this hormone. What is the GLP agonist, or that drug class that we keep learning about? What do they do?
Yeah, it's called the GLP-1 receptor agonist. Basically, what does it mean? It's actually a peptide, a short peptide that is synthesized by big companies. I'm sure that you heard about Novo Nordisk. It's a Dutch company, Danish company, and Lilly, which is actually an American company. So they produce those a small molecule by those pharmaceutical companies, and they bind to the receptor of the endogenous GLP-1 and activate it. and they do it by interacting with the receptor, but they are not react precisely as the hormone. They react a bit differently, and also what those pharmaceutical companies have done, they made them much more stable and much more potent. So if some of you are old enough and remember a drug called Saxenda that developed by Novo Nordisk, I don't know, like more than 10 years ago, this drug was much less potent, but also was much less stable. And you needed to inject it every day. And today, all of those drugs, you just inject it once a week, which is much easier, but also they are much more potent.
And where do these things work? Where does the peptide work, or the hormone works? What are the target organs for them?
Yeah. So yeah, that's a great question. And I'm not sure that we know everything about that. But what we know as of today is that it signaled to the brain that now there is enough food and you should feel full. So basically it's make you feel fuller faster. And I have a few friends that are on GLP-1. I'm sure that everyone has some friends because a lot of us are on GLP-1. And basically this friend came to me one day, a few days ago, and I told him, it's a magic. I went to work, I drank coffee, and usually I eat breakfast, and I forgot about breakfast, and suddenly it was lunch. So basically what it's showing to you, even if you drink coffee with a bit of milk, you feel full until lunch. So basically it's make you feel fuller faster and longer. It's also, as we said before, stimulate insulin secretion to absorb glucose, and we'll discuss it later. One of the early use of the GLP-1 was for diabetic population, and we'll discuss also later what a miracle it's making right now. As we said before, it delayed the progress of the food in our gut, so everything moves slower. And because it's moved slower, you feel fuller longer because the gut and the stomach are full. So the signal to the body is, hey, I'm still full. Don't eat a snack right now. You don't need it. And in people with obesity and diabetes, it's decreased significantly inflammation and improve the health of a vascular system. And I'm sure that you heard in other episodes of Longevity by Design, inflammation is a very bad signal or disease for longevity. And the fact that it decreases is really exciting. We are not sure yet on normal weight people because there haven't been enough research about what the GLP-1 is doing with normal weight people. I'm sure that now, and before recording, Ashley and I discuss it, there is a more and more signals or some clues that a lot of people that have a normal BMI or slightly overweight are using the GLP-1 because they want to shed the last 5 pounds to go to the beach and look good, or to have a wedding, they want to look good for the wedding, or whatever. Yeah. And so I feel that pretty soon we'll know what happens with the normal BMI people and not obese or diabetic.
Yeah. I'm going to come right back to that. But I think one thing, maybe when you are talking to people that are on these, you often hear that they not only get full faster, but they feel full all of the time. And for people that have obesity or have struggled with obesity, I think one thing we hear a lot is they have this food noise in their mind of just constantly thinking about food. By the time they finish their first meal, they're already kind of very interested about what they can eat next. So it's interesting to think of, or I guess to just talk about the impacts on the brain and how that really does impact people just not having an interest in food that they used to be so obsessed about.
Yeah.
Yeah. On that note of people taking it to lose 5 pounds for a wedding, that is not really the kind of patients that should be taking these drugs. That doesn't mean they're not. But what kind of patients should really be taking these GLP-1 agonists?
Yeah, so at the beginning, this drug was developed for a diabetic population. And so there's definitely diabetic, especially diabetic that are overweight, mainly type 2 diabetes patients should be on this drug. And for them, it's decrease inflammation and improve the health of the vascular system. Very exciting, and for me it was amazing. Again, at the interview that we had a few months ago, more than 50% of those patients with the type 2 diabetes who consumed the drug for more than 40 weeks in the high dose, basically not the lower dose, basically has completely normal glucose level in terms of hemoglobin A1C, meaning that they completely transform from being diabetic to being normal. And that's, it's amazing. It's like unbelievable how many things have we tried to combat diabetes. And now think about it, 50% of the diabetic, if they will know about it or the clinician know about it and will take it, maybe more, we don't know, basically become normal. And the diabetes, if you look again in the direction of longevity, a person with diabetes on average live around 11 or 12 years less than person without diabetes. So the effect on longevity can be amazing. And again, if there is anyone here that is diabetic or type 2 diabetes, let's say, not type 1, or have someone that you know that is diabetic, go to your clinician and talk with him about that. And maybe this drug is good for you. So that's about diabetes. Now, obesity. So as we know, obesity is the starting point for a lot of diseases, including diabetes. And basically in the obese population, taking the GLP-1 decreased the risk to become a diabetic by 94%. It's almost everyone, almost every obese person that will take this drug won't be a diabetic. And again, we are going back to diabetes, and you might live 12 years less. So it's crazy. It's amazing. In an overweight population, the GLP-1 agonist can decrease the body weight by up to 25%. Think about it, 25% is a level of bariatric surgery. It is crazy, and it depends on the drug that you are taking. So Eli Lilly, the GLP-1 that they have is a dual agonist, meaning that they have the GLP-1 and another small molecules like that, and that drug can decrease by 25%. While the Novo Nordisk one, which only have the GLP-1, decrease it by up to 15%, which is still very significant. Right. I think about someone that is 200 pounds and he lose 15%, is decrease 30 pounds. That's not bad. But if you decrease 25%, it's already 50 pounds. That's much bigger. So that's amazing for the overweight population. But there is more. It's crazy. For cardiovascular diseases, there is a significant decrease in the risk of developing cardiovascular death, myocardial infarction, stroke, and also heart failure. So basically, a lot of the cardiovascular diseases can be prevented or delayed by taking those GLP-1 agonists. But still, we have more. What about brain disorder? So there are some data. It's still new, so it's not verified 1%, but the GLP-1 agonists improve cognition and decrease dementia, which is also, if you think about it, dementia is really age-related diseases, so it can improve significantly the health span of, let's say, the population. Very strong data show that it's very important for kidney disease or prevention of kidney diseases. It's improved the kidney function by improvement of the glomerular filtration activity. Also, there is some data about fertility, and especially for the PCOS. And we know that PCOS syndrome is basically, a lot of it is because of overweight. So it's not surprising that when you consume the GLP-1 agonist, it's improved significantly. I want to mention that there is some data also for males. So I'm not sure that we know yet why, but a very good effect of fertility. So know that anyone that is in that age and thinking about bringing offspring and he or she are overweight, that can help significantly. Last but not least is the cancer incidence. So there are around 14 different kinds of cancer that are related to overweight and obesity. And a recent study, which was a very detailed and a very high number of patients, found that 10 of those 13 cancer were very much reduced during therapy with GLP-1 agonists. So think about it. It's really, really amazing. Cancer and fertility and kidney diseases and brain disorder and cardiovascular diseases and obesity and diabetes. Unbelievable.
Yeah, almost in line with exercise. I feel like as one of those things that impacts basically every single thing. I also was reading papers about addiction too. People that struggle with alcohol addiction in particular. I don't think there's quite as robust research, but being something that similar to reducing that food noise can also reduce the call of whatever that individual is addicted to, which is really, really interesting. Okay, so you've convinced someone or someone's doctor has been instrumental in them starting one of these medications. The patient reaches their goal weight or they're no longer diabetic. Does that mean that they should stop these GLP-1 agonists?
Yeah.
Or is it something they should take forever?
Yeah, that's a good question. And the short answer, we don't really know yet, but most likely you will need to be on it. And the reason for that is a GLP-1 agonist reduce appetite. And if you stop taking it, most likely you will be hungry again and you will start eating more. So most likely you will need to, but I think that during the time that you are on the GLP-1 is like a training. You got like a gold ticket or gold card that you can use in order to train your body from the beginning. So instead of eating processed food, try to eat natural food. Try to eat food that is less dense with calorie dense, and try basically to train your body and train yourself to like better foods. And it will be easier for you because you won't need to eat a lot. So basically, if you are hungry, eat a cucumber instead of potato chips. And so that's one way that you can, and you have most likely a year or two to train it, so try very hard to do it. Another thing that is important is, and we discuss it later in the side effect, also try to exercise more. Try to, in a way, there was an interesting study that showed that people on GLP-1 spend much less money on food because they consume less. So use that money that you save to have a gym membership or buy a bike or, find a Zumba class. Do whatever you like, exercise, and try to become addicted to something that help you to burn calories. Again, you will have more time because you need to cook less. You have more money because you need to spend less money on food. So try to train your body to eat a better food. And try to train your body to exercise more, and maybe then you can. And there are some assumption that you can titrate the level a bit lower. So hopefully we can find a way, but as we are looking at it today, a lot of us will need to stay on the GLP-1 for life.
Yeah, I think that's an important thing, is putting obesity also in a class of disease with other things. If you take a statin to lower your cholesterol, doesn't mean you can stop taking the statin and your cholesterol will stay low. If you're on metformin for diabetes or blood pressure medicine because you have high blood pressure, just because you reach those normal levels doesn't mean you no longer have that condition. And I think a lot of that changes. Obesity is a chronic, progressive condition that will get worse. It's not necessarily something that goes away. So reaching your goal is not the end of it. Yeah.
By the way, Ashley, speaking about blood pressure, there is a strong correlation between high blood pressure and weight. So if you are overweight or obese and you are taking blood pressure medication, there is a good chance that you won't need it anymore. So in a way, you switch one drug with each other. You won't need a blood pressure drug, but you might need to continue to take the GLP-1. But so just take that into consideration.
Yeah, and that makes me think of your example of people that are taking it for the beach or a wedding. Unfortunately, once they stop, they're going to gain those 5 to 10 pounds back. But who knows if it's worth staying on forever for 5 pounds? But
yeah, no, I agree with you. I don't think that it's worth taking it. It's a great tool for the overweight and obese that basically they have some a disease, and in a way, actually, I'm thinking about it. It's a good discovery because a lot of people that are overweight or obese, a lot of us came to them and say, hey, you have a problem. How come I'm not obese and I'm not overweight and you are overweight? Now we found that there is a reason. They don't produce enough GLP-1 and it's a real disease. So I think that those people should feel much better right now. Yeah, I have a disease. It's okay. It's like a cardiovascular disease or diabetes or cancer. And now I have a drug to treat it. So I think that it's very good also for their emotion and for their mental stability. It's not like I'm not okay. I have a disease and that's it.
As a Longevity by Design podcast listener, you understand the value of improving your health for today and for all the years ahead. And if you want to live your healthiest, longest life possible, you need to understand what's going on inside. At Inside Tracker, we take a personalized approach to health span optimization that eliminates guesswork from your wellness plan. Inside Tracker analyzes blood biomarker and DNA data, along with physiomarker data from fitness trackers like Oura Ring, to deliver personalized food, supplement, lifestyle, and exercise recommendations that allow you to take control and improve your health span. And for a limited time, Longevity by Design listeners can get 20% off at the Inside Tracker store. So if you're ready to receive a personal health analysis and data-driven wellness plan to optimize your body for the long haul, then it's time to start inside. Visit insidetracker.com/podcast to get started today. That's insidetracker.com/podcast to get started today.
Yeah, I think it's the public needs to get that switch too. It's not all willpower or not being able to do it.
Exactly.
Some people respond very differently in the exact same environment than others.
Absolutely.
Okay, so it is not for everyone. There are definitely side effects of GLP-1 agonists that I think are definitely important to mention. And if you know anyone that's taking these, I'm sure maybe they've shared some things that happen. But I think it's worth a good discussion on those as well.
Yeah, absolutely. So I think that in my opinion, the most important one and the one that everyone should pay attention to is basically muscle loss. So when you lose weight, around 50% of the weight will come from the muscle. So you will lose a lot of muscle. And we discuss it in this podcast, I don't know, maybe 10 episodes about how to build muscle, how important is the muscle. But in a nutshell, the muscle help you to move. The muscle is the biggest consumer of glucose. So it's basically maintain your glucose. And it's also protect your bones. And it's very important for you being at the old age and be active and be healthy. So because of that, people that are on GLP-1 should pay attention a lot to exercise. They should try to exercise as much as possible. Mainly weightlifting and trying to build and maintain the muscle that they have. And also because muscles are built mainly from protein, they should have a diet that enrich a bit in protein in order to allow the body to build more muscle. So that's something very important for everyone to know, that you should pay a lot of attention for your muscle. You should go to the gym and lift weight and exercise as much as you can and take it even more seriously than before. Another problem is because you consume less food, and absorb less food, a lot of the GLP-1 agonist users are having a low level of vitamin, calcium, mineral, and they should be aware of that, try to supplement with those. And we don't know enough yet about them. There are a lot of research that's going about that. But I think that I would strongly recommend you to do a frequent blood test and see what macro and micronutrient you don't have enough, and then supplement it. A good example of a service that do that is us, Inside Tracker. So you can test with Inside Tracker and find whether you have a deficiency of a lot of different kind of vitamins and minerals. One side effect that is happening literally at the beginning is basically nausea and vomiting. And what those pharmaceutical companies have done is that you are starting with a lower dose, relatively lower dose, and with time you are titrating higher and higher. So basically, that's allow your body to get used to that and basically decrease the chance to have this side effect. But some people have it strongly. So what is nice about it, and we'll discuss later, now there are at least two different kind of GLP-1, the Novo Nordisk and the Lilly. So you can, if one is making you, providing this side effect, try the other. And also I assume that more will come, and we'll discuss later about other ways to consume it. So I think that even if now you have a big side effect of vomiting and nausea, I think that in the future you can find a way to get over it. Another side effect that is pretty rare is an increase in the risk of developing gallstones. And that's something that definitely happening, but not in the majority of the users. So just know that and discuss it with your clinician, and maybe monitor and be sure that you don't have this risk. And another interesting one that just discovered recently is the increase in the resting heart rate. So we know that resting heart rate is a very important, and the lower the resting heart rate, you are more healthier. There is a lot of data, and also we discussed it in the episode, that the resting heart rate of the GLP-1 consumer is higher by 5 to 10 beats, comparing to someone that haven't done it, or comparing to before using it. The good news that currently the scientists don't think that it's something that can influence your cardiovascular health too much. Yeah. So it's a risk that it's not great, but it's not something that is very bad. And as we discussed before, there are a lot of positive effects of the cardiovascular diseases in consuming GLP-1. So basically, in a way, they neutralize each other. But it's going back actually to your point about losing 5 pounds for the beach. Or it's better if you don't need a drug, don't take it. So if your BMI is 25 and you want to be 24, try diet and exercise and don't go with that. But again, if you want to do it, you are welcome. Nobody force you not to do it.
Yeah, I think too, maybe a little history on these drugs. And you mentioned Saxenda before, that it was FDA approved. It was 2014 for type 2 diabetes. Ozempic is the one we hear about all the time now. It was approved by the FDA in 2017 for type 2 diabetes. And then recently in 2021 and 2022 is really when the approval for treatment of obesity came through. So maybe you've heard about some of these for a while, or you've seen their commercials on the news for a while, but all of the press recently is because that treatment has shifted from just diabetes, type 2 diabetes, to now be for obesity. So thinking about those drugs, the two big companies that you mentioned, Eli Lilly and Novo Nordisk, which one should, what's the difference between them, or how would somebody decide which one they would want to take?
Yeah, so as we discussed before, the Lilly drug has two different hormones, a GLP-1 and another is hormone, a small molecule. And also, it uses a much higher dose. So the expected weight loss for the Lilly one can be up to 25%, while the weight loss that expected from the Novo Nordisk one is only, and I'm doing it quotation, 15%, which is still a lot. So one consideration is how much weight do you need to lose? If you just need to lose just 15%, maybe go with the Novo Nordisk. If you need to lose more, maybe the Lilly is the right one. Another point is we are very lucky that we have two different drugs for this. So again, if you have a side effect of one, maybe you won't have the side effect for the other. So start with one, and if you see some side effect, try to move to the other one, and hopefully you won't have the side effect. Lilly P1 is also using much higher dose, so they are using up to 15 milligram per week, while the Novo Nordisk only use 2.4 milligram per week. And I assume that, and I know that they are actually developing a much more potent injectable, so it will come soon. And yeah, so that's the high level. You should basically consult with your physician, also see what is available. We know that there was a big waiting list of people that wanted to use it and couldn't use it. And then they went to the compounding pharmacy. And at least in the US, it was very interesting that a lot of online companies started to sell it, and they made a lot of money. And very recently, maybe a couple of weeks ago, basically Novo Nordisk declared that there is no shortage anymore. So those companies cannot do the compounding pharmacy anymore. So it will be interesting to see what will happen with those companies. Also, it will be interesting to see the adoption of it. And actually, you mentioned in the pre-recording that now also the big companies, Novo and Lilly, are starting to decrease the price to someone that is not covered. So it's starting to be more affordable. And that's very important because, as we discussed in the early episode, there is a correlation between socioeconomic status and BMI. Namely, people that have a less socioeconomic, let's say, a lower salary, usually are heavier and have a higher BMI. And usually those people cannot afford to pay $1,000 a month like what it used to be before. So I think that with time, with the coverage of the health insurance, those drugs will come to the people that really need them, and not again the person that tried to lose 5 pounds for the beach.
Yeah. And a lot of the obesity doctors that I follow, I've just been cheering that the price has come down to $4.99 a month for them, and that the shortage is over, because that lack of coverage or that lack of available GLP-1s was what really ushered in those compounding pharmacies. And that commercial during the Super Bowl, which I don't know if I can even say the company name, but that was
Hims and Her, isn't it?
Yeah, Hims and Hers, of like just going online and ordering them. Because they're not FDA approved, they also weren't required to say all of the potential side effects like all FDA approved medications are in a commercial. It was just a big uproar. Anyway, so I think, one, yes, more people will get them, but two, it'll also start to push out some of these compounding pharmacies that aren't FDA approved. Nobody's checking on what they're actually putting in there out. So it'll also make it safer.
And I think that that's a very good point. This is a drug, so don't. I strongly recommend not to do it without talking with your primary care physician, or if you are a diabetic, your specialized clinician to do that, because it's a drug and you might have some side effects, as we discussed before, and it's better to do it under the supervision of a clinician.
Yeah. Okay, what about how people should take it, like oral versus injectable? What's available out there?
Yeah, so very recently, the first oral GLP-1 came to the market, but it's still the first one, and we don't know a lot. So basically, it might be the next revolution of the GLP-1. If we were going back to what you said about Saxenda, so it started with something that you had to inject every day, and the dose was low and the effect was smaller. Then they came with the more stable one that can stay for a week and also more potent, and suddenly we can lose 15%. And then Lilly came with 2 different hormones, and you can lose 25%. And now the oral is coming. And the interesting about the oral, it's much easier. You just need to take it. You don't have the non-comfort of injecting your body. But there are some considerations that you need to know. For example, you need to be fasted when you consume the oral one, and you shouldn't eat for half an hour after that. And as I said, there is only one oral kind in the market. There are a lot in phase 3, so I assume that they will come. It's not only Lilly and Novo Nordisk. Actually, a lot of companies are. It's like the holy grail right now. Every pharmaceutical company is trying to make a GLP-1 agonist, because there is so much money there. Another point that you need to remember about the oral is that when you take an oral pill, it's go via your gut, and the accessibility, the majority of it will be void and won't get into your body. So you will need to, the companies that make it, the dose should be much higher. And maybe that will make the world supply of those GLP-1 agonists much lower, so it can cover less people. Also, when I discuss it in the episode, what I learned is that basically injection once a week, it's not the end of the world. As I said in the episode, it's like clipping your nails once a week. So you clip your nails and inject it. While taking a drug every day, the compliance is much higher. So there are pros and cons to each, and I think that, again, talk with your clinician and decide, but I think that both of them can be very interesting and exciting, and the GLP-1 is a big revolution. I see it as big as the AI revolution, and it can increase significantly the lifespan, but more importantly, the health span of the human population just by one drug, which is, I don't know about any other drug in the recent history that have done something like that.
Yeah. Well, thanks for the summary, Gil. As a reminder, this was not medical advice, just having a discussion about what there is to know so far about these. And if you want to take them, please talk to your doctor. Don't go through those compounding pharmacies. Okay, now let's transition over to wearables and kind of what the landscape for those looks like now too.
Yeah, so I think that the wearable becoming very exciting and very interesting. It used to be a market for the early adapters, and now I think that the Apple Watch users are reaching to almost 100 million people, and companies like Oura are close to 2 million or maybe more. So it's starting to be more accessible, and more people are thinking about it. But they are confused and they don't know which wearable they should buy or select or use. So one anecdote, last week I had the opportunity to present at a private event of founder and funders. And as soon as I arrived, a highly successful entrepreneur approached me and she said, I did some research on you and I have a quick question. So I said, sure, what is your question? And she asked, what kind of wearable should I buy? And I want to say that I'm hearing it from a lot of people. So there is a lot of confusion. What is the best wearable for me? And my response to her was, it depends. It depends of why do you want a wearable? What is the reason for you to have a wearable? So question that I really recommend you to ask if you don't have a wearable, or if you have a wearable and want to try a different one, the first question is, why do you want a wearable? What challenges are you trying to solve with the wearable? Are you having a problem of falling asleep? Do you want to measure your steps? Do you want to see what is your resting heart rate? Do you want to see your VO2 max? There are a lot of things that you can receive from wearable, and based on that, you can see what feature each wearable has. Another one, how curious you are about health data. Are you a normal user or a deeply invested self-quantified person? Are you going to be addicted to it, or just having it on your wrist and once in a while look at it? And that can also detect whether you are more like a Apple Health, that I would say it's a less casual person, or someone more addicted like, I don't know, Oura or a Whoop. Another question is, how much time are you willing to spend on it? Will you check the app for 10 seconds a day or dive into it for 10 minutes? If you are more like the 10 second, there are some apps that are more easily, allowing you more easily to digest the data. Like I would say Oura Ring is better for you. If you are someone super duper that want to know everything and see every number, maybe Whoop is better for you because it has more information, but you need to invest more time. Another question is, how often will you engage with the data? Do you see yourself checking multiple times a day or once in a while? And again, that can detect what kind of wearable you should buy or try.
Gil, just a personal question. Which wearables do you wear or have worn in the past?
No. So I'm now using Oura Ring, Whoop, and Apple Watch. And I wanted to use more, but I don't have enough space on my hands. And also, it's like, I call them like kids. You need to take care of them. You need to charge them. You need to look at them. You need to understand them. I'm doing it because I like it, but also it's my job. But it's a lot of investment. Investment is not only the money, because think about it, Apple Watch, you don't have membership, so you buy it and that's it. But Oura and Whoop, you need to pay a membership fee and pay it every month. So it's a good question. So it's also how much money are you willing to spend on it, not only as a one time, but also at a recurring expense.
Yeah, maybe you're not a normal use case. And you need
No,
another
I'm
wrist to try
definitely
something
not.
else.
No, I'm definitely not. So don't learn from me. Nobody needs 3 different wearables on his head.
It's interesting thing. When I started Inside Tracker in 2015, I think like Fitbit was like pretty brand new.
Yeah.
Like that was really the only option. And it was kind of weird to wear it. Like, why are you tracking your steps?
Yeah.
And then I got into endurance racing for a little while and I was wearing a Garmin. And then now I have an Apple Watch that I always forget to charge. So I rarely wear it. But it's, now even on your phone, if you don't want those, your phone's kind of collecting some of this data on you as well. So it's interesting just to think that even 10 years ago, we like had none of this
Yeah.
to where it's really evolved.
Yeah, no, it's a real revolution, and basically we are quantifying ourselves in the different levels. So some people crazy like me are quantifying everything, and some other, even as you said with the phone, if you put it in your pocket, you know your steps that you accumulate. If you charge it when you go to sleep, it might know when you went to sleep. You know how many times you open it, when you open it. What is the noise level? There are so many things that the phone can have, which is it's crazy how much information you can extract, even not from wearable, just from your phone.
Yeah. So all of them kind of can do different things. Is there a wearable that can help detect if you're going to be sick or if you're getting sick?
Yeah. So that's a great question. And actually, a few months ago, I came from a conference. And it's one of the biggest conferences in the world. It's called CES, Consumer Electronic Show. I think that around 120,000 people were there.
Wow.
And I assume that some of them coughed on me, so I got sick. And what I was amazed about is that my Oura Ring actually gave me an alert a few days before I felt sick, that I'm going to be sick. And also show me what they're seeing. So they're saying that the breathing, the number of breathing per second were too high, and my HRV was too low, and so on and so forth. So gave me a lot of information, and also in my temperature. So it's measured temperature, show my body temperature was too high, and they also gave me some hint, and I knew, okay, I should take it easy. A lot of us are type A, and I need to go to the gym at least once a day, maybe twice sometimes. So it showed me, gave me a reason, okay, you shouldn't go to the gym, just rest and recover. So I think that for finding whether you are sick and showing you the progress and providing recommendation related to that, definitely Oura Ring is a great tool, and providing to you a very good point of what to focus on, especially when you are sick, which I haven't seen with other wearables.
I remember in like maybe 2017, I was still on a Fitbit track, maybe 16. And my heart rate, it was they started tracking heart rate in addition to steps, and I could see it going up every day for a week. And then I never call out of work. I do not take sick days. Like I have to be really sick. And that was the first time I called out of work for Inside Tracker. And I looked at that and my heart rate had gone up like 12 beats per minute over the course of like a week. And I took a screenshot of it then, and I used that screenshot in slides that I teach in sports nutrition now. It's way more advanced, but it's just kind of cool that that's something that you can get from these as well. Absolutely. And Oura Ring has way more metrics than just heart rate. That's cool.
Yeah.
What about any wearables that are good for detecting falls for the elderly?
Yeah, so another interesting experience that I had, not me, but with my mom. My mom is 90 and she's fully functional. But a few years ago, I bought her an Apple Watch. And Apple Watch have a very nice feature that first it's detect fall, but also you can basically set it up that if there is a fall, it can call a couple of relatives and also the police. So a few weeks ago, she fell and she lost her conscious. And immediately her Apple Watch called my relatives and also the police. The EMT came immediately and basically saved their lives. So I think that's something that, in my opinion, for the elderly is an amazing tool, because especially my mom and my father live alone. They are completely functional, but still, as I said before, they can fall and they can lose conscious. And think about it, if it was a bit longer, the circumstances could be very bad. So I think that something like Apple Watch, but there are also some right now, some startup that creating a specific wearable for the elderly. I think that that's something that will grow significantly in the future and have a lot of value, because in moment like that, if you every second is important, and detecting that's a game changer. So again, if you have elderly parents or someone elderly, consider investing in something like that to provide you a peace of mind, and also hopefully allow them to live better longer when they face this issue.
I think Jonathan, one of the Inside Tracker employees, had a friend who was hit by a car riding his bike, and the Apple Watch similarly called the ambulance and called a parent or a partner or something, like right away, and the person didn't do anything for it. So it's a super cool feature.
Yeah. No, so just to add to that, it's a good point, Ashley. So for my mom, I set it that always. For me, it's set only when I exercise. So, and then exactly when if I'm running or if I'm on the bike and I fall, immediately it's doing it, but it's not doing it when I'm sitting here and talking with you, because the risk is very low. So you can play with the setting and decide how often do you want to receive this call or send the call to the police or the EMT.
Yeah. Okay. How about Whoop? What are some things that you maybe like or have found that Whoop offers that your other two don't?
Yeah, so I think that what is cool about Whoop, that it's providing to you a lot of information. So you need to be more like quantified selfer, that you look at it and understand it. One tool that I really like is it's called the Daily Journal. So basically, it's allow you or force you to every morning to say exactly, to add something that the wearable is not collecting. For example, you add a massage therapy, or you flew on the airplane and you have a jet lag, or you ate a late dinner, or you drank alcohol, or whatever. So you add all of that information, and that's collected, and try to provide you then some insight about that, and that's going to something that's called the Whoop Coach. That basically it's like a LLM-like solution that looking at your information, summarize the day before, and providing you some recommendation, what kind of exercise you should do, how much you should exercise, when you should go to sleep, and so on. So I think that Whoop, again, is something that for the more engaged personnel, you receive a lot of information, but again, you need to dedicate a bit more time. So it's not like the Apple Watch or that you can do it in 10 seconds. You might need to dedicate, I don't know, a few minutes a day. Again, it's not the end of the world, but today with our attention span, not everyone is willing to spend a few minutes a day. So just know that.
Yeah. All right. Awesome. Well, thanks, Gil, as always, for all of your insights. As we wrap up this discussion on GLP-1s, I think it's super clear that this groundbreaking hormone and its pharmaceutical counterparts are transforming the way we approach weight management, diabetes, cardiovascular health, even cognitive function. And that science is evolving very rapidly, offering new hope for individuals seeking to improve their long-term health and well-being. But as with any innovation, understanding the nuances, like the side effects, long-term use, the right drug for your needs is essential. And whether you're considering a GLP-1 agonist, exploring wearables for health tracking, as we just talked about, or simply looking for ways to optimize your lifestyle, staying informed is really key. Speaking of optimization, wearables are playing an increasingly vital role in personal health monitoring, from tracking early signs of illness to improving recovery, guiding fitness, and even detecting falls in older adults. These devices are becoming essential tools for proactive health management. Whether it's the Oura Ring for illness, the Apple Watch for falls, or Whoop for lifestyle tracking, leveraging technology can help us make smarter, data-driven health decisions. Thank you for joining us on this episode of Longevity by Design. If you found this conversation valuable, don't forget to subscribe, share, and continue exploring the science behind longevity. Until next time, stay curious, stay healthy, and keep designing your path to a longer, healthier life.
Thank you so much, Ashley. That was a lot of fun discussion with you.
Yeah, it was fun. A nice return to my podcasting days.
Thanks for listening to Longevity by Design. Please subscribe to this podcast on Apple, Spotify, or YouTube. Longevity by Design is powered by Inside Tracker, a personalized health optimization platform that helps people improve their lives by improving their bodies from the inside out, using personalized, science-backed recommendations for nutrition, supplements, and lifestyle changes. To learn more, visit insidetracker.com/podcast.